You matter. How you interact with people, how you care for people, can actually influence the development of the brain. In a classic study of rat pups, they took some rat pups and kept them with their mothers. And the mothers licked and groomed them. And then they took another set of rat pups and took them away from their mothers, where they had very little licking and grooming. They then looked at the brains of each. And what they noticed was when that rat pup was cared for by the mother who loved them, by licking and grooming, they had significant growth and development, much more than those who weren't cared for in their brain. This is called neuroplasticity, that how we care for others can actually influence the development of the brain. We're going to explore this together. We're going to explore the power of you. So this is the circle of health, with you at the center, being mindfully aware of what your patient needs most. And if we can get them motivated to invest in these circles, these ingredients of health, that can come through you. And if we can get them to believe that this is important work, their body will do all it can to heal. Part of the challenge here in doing this work is having enough time to really hear the patient's story. An example of that is this study from Jerusalem to Jericho. These were seminary students going to give a talk on being a good Samaritan. They were divided up into 3 groups. The first group, they said, you have plenty of time, go on over and give your talk to these people who will be waiting and give your talk on being a good Samaritan. The second group, time's getting a little short, go on over there, give your talk on being a good Samaritan. The third group, as you might imagine, you're late. They're going to be upset, get on over there, give your talk on being a good Samaritan. And in between the 2 buildings where every student had to walk, they planted a man suffering in pain. So let's recap. We had seminary students going to give a talk on being a good Samaritan. They wanted to see who would stop and actually be a good Samaritan. As you might expect, that first group, almost all the students stopped. The second group, many walked on by. And the third group, almost all of them walked on by. And one guy actually hurdled over the poor dude. Even if we're going to talk about being a good Samaritan and we don't have enough time and the system doesn't allow it, we hurdle over the very thing we're going to talk about. A helpful equation to help us understand how we can be most effective as clinicians is this one, about whether patients trust us or not. Trust equals intimacy times competency divided by degree of risk. So if you have metastatic cancer, and you see the most competent physician in the world who's written all the papers, but they don't even look at you, they don't make you feel cared for, you're probably going to go somewhere else because your degree of risk is pretty high. Vice versa is also true. If you have a great, compassionate physician who doesn't know their stuff and your degree of risk is high, you're going to go elsewhere. Intimacy and competency are both really important. We got to know our science, we got to know our stuff. And we have to provide that knowledge in a very compassionate, caring, empathetic way. That together matters most. So with everything we prescribe, there's specific variables and non-specific variables. The specific variable is the power of the penicillin and how well it kills that bacteria. The non-specific variables are the ritual and ceremony that surround the specific variables. What we're going to explore is the power of those non-specific variables. And surprisingly, the power of those non-specific variables sometimes can trump or enhance the power of that penicillin. These non-specific variables are grounded within relationship-centered care. That place where we provide empathy and compassion. 2 powerful ones are how we perceive things and how we create expectancy. So perception drives everything. If I perceive the patient as potentially healthy, then I give them permission to be healthy. If they perceive themselves as sick or ill, they're going to get stuck in that paradigm of sickness and disease. Look at these almonds. Initially, you might see some movement. They're not really moving. They're moving because you're moving. You're trying to focus, multitask on all the different almonds at once. And when we do that, we start to see things as we are, not as they truly are. But now allow your focus and gaze to settle on just one. See one thing well. And when your eye focuses on that one thing, the movement stops. And you start to see life as it truly is. Not as you are, as it truly is. You start to make the more accurate diagnosis. You start to understand what's at the root of those symptoms that will help you help them find their whole health. So another nonspecific variable is expectancy. I think one of the most important things I can do for a patient is to believe in their body's ability to heal. Once we believe in them, they give themselves permission to believe the same. And they expect to get better because you believe in them. A fun study of expectancy was of demolition derby drivers. The researchers wanted to see what the incidence of neck pain was beyond a year. And they compared demolition derby drivers who averaged about 25 rear-end collisions per derby and about 30 derbies a year. You do the math, that's a lot of rear-end collisions, compared to the general public who was in just one rear-end collision. Just one. The incidence of chronic neck pain that lasted beyond a year for the general public after just one rear-end collision was 10%. How about the derby drivers? Those people are doing it for fun. After multiple rear-end collisions, the incidence of chronic neck pain that lasts beyond 1 year, 0.25%. Now, how is the expectancy different? What if you were a mom with your 2 kids in the back seat and you look down at your cell phone and poof, fear, guilt, tension. Where do you hold that stress? One rear-end collision. Now compare that to the demolition derby driver. They're doing it for fun, right? Yeehaw! You know, yeah, it was a good one. That expectancy is different. And that actually influences the outcomes that we see. A study that shows the power of human connection and expectancy was done post-operatively in people who were having a lot of pain after a surgery. They divided the group into 2. One group received morphine from a kind, caring nurse. The other group received it from a computer behind a screen where they didn't know the timing of the administration. And what we see here initially is that the pain is quite high after their surgery. And then here is where the morphine was given. And when the morphine was administered by a kind, empathetic nurse saying, hey, we're going to help you get over your pain with this medication. Look at how much that pain went down in those patients versus in the red when it was just given randomly from a computer behind a screen with no human interaction. It took much longer for that pain to go down. Now, then they reversed it. They said, hey, we're going to turn off the pain medicine. And again, that message came from a human being, or they just turned it off from the computer behind the screen. And then look at how much more their pain increased when the nurse came and said, I'm turning off the morphine, versus it when it was just turned off randomly at this time. Look at how much longer it took for that pain to rise when it was just turned off. That human connection, the caring, how we give therapies matters. It can stimulate pain resolution or more pain. This human connection really makes a difference. If we can stack the deck in favor that includes all these nonspecific variables, we can significantly influence outcomes. We did a study on the common cold, the most common infectious disease on this planet. We divided people into 3 groups. One where they didn't see a clinician at all, one where they saw a connected visit, where we stacked the deck in favor of all those nonspecific variables that influence healing, such as empathy and compassion and empowerment and connection. And then we had a group that was limited, where we were kind of in and out. We didn't connect with them. We then did nasal washes to see if they had these immune markers called cytokines, interleukin 8, as well as nasal neutrophils, to see if their perception of empathy from their clinical visit may actually influence. And sure enough, it did. It influenced 3 things. If they saw their clinician as perfect in empathy, it reduced the duration of the common cold by 1.11 days, it reduced the severity, and it dramatically increased these immune markers within the nose that we use to fight off a cold. An interesting finding in our study was that the group that stayed home and didn't see a doctor at all did better than those who saw a grumpy, burned out doctor who did not rate perfect in empathy. So if you're burned out and you're not on your A game, you could actually cause harm. You matter. This was also reproduced with irritable bowel syndrome as well as depression, that when people perceive their clinician as empathetic and caring, that has a significant impact on the outcomes. One unfortunate study shows that during medical school, we train empathy out of our medical students. Women generally come in with more empathy into medical school than men in the bottom group. But look at what happens to empathy as we go through the first through 4 years of medical school. We actually train out one of the most important non-specific variables that we can give to patients to facilitate their health and healing. That's an opportunity. How can we honor these non-specific variables? Empathy being one of the most important ones. And we define empathy with 3 ingredients. Number 1 is that we feel and listen. We listen and feel the story. We repeat it back to them, and then we do something about it. That is a key, powerful ingredient that often can result in these positive health outcomes. How can we stack the deck in favor of including all these non-specific variables to result in healthy outcomes is summarized with this Relieve mnemonic. The R stands for relationship-centered care that's built on empathy and trust that creates a positive environment where the clinician can listen to a complicated story that creates insight into a problem that results in an explanation that is consistent with the patient's values, leading to empowerment and action towards health. So in this work, we have the opportunity to be with people. And in that communication, that relationship, sometimes some magic happens, where we get out of the routine and we have that magical aha moment, where this neuron connects to that neuron. And that aha moment happens where you know something special happened, and when you both leave that room, you've both been changed. And you know that's going to lead to some sort of behavior that's going to have a positive outcome because you believed in their potential to heal. You are powerful. The power of you can make all the difference.